talked about the principles of sighting. We're going to put a dot on either side of your tummy, and we're going to look at where's best on your abdomen in relation to your clothing, any abdominal folds or creases you might have. I'm sure it's smooth as a... and just for comfort and where you can see it. Is that all right?
Yeah,
show me your tummy.
Yeah, of course.
Okay. Okay. So what we're going to do is I'm going to find what we call the iliac crest, which is effectively your hip, and that's there, yeah. And then we go from there across to your umbilicus, and it's sort of a third to a half of the way across, okay? And that's really the optimum point. And we do that because we know that that is likely where you've got a good bank of muscle called your rectus muscle, okay? Buckle. And you're over this side as well. All right, and again, just here. Okay, right. So this is, I might consider moving that one down. Can you see the crease here? We just want to maybe move that down a little bit like that, okay? And this is sort of, as I said, optimum because you've got the nice muscles coming down here. If they cut your abdomen there, you're still a good deal away from that. And although you've got a crease on your umbilicus, that shouldn't affect the bag at all. So now you're sitting up, you can see your abdomen looks slightly different. That crease is a bit more pronounced. And now that I'm looking at it, that looks a bit low to me. All right. So obviously your trousers will come up and over the bag. Does that make sense?
Yeah.
But actually that's a little bit, although it's nicely on that crest of your abdomen there, in terms of you being able to see it and being able to see under the stoma to put the bag on, I might just go back up again, all right? Which is why we use the stickers. Does that make sense?
That much better.
Yeah. And this one, again, I might just move slightly in a bit, just because, obviously, again, you don't want anything that's around the side that will be difficult to look after. Okay. If you stand up for me, that would be great. And we can then just see how that changes. So that still looks very good to me. You've got nice, I know that you said when we spoke that you've got an appendix scar there, but actually that won't impact that at all. That's nicely away from that. And if I just show you while you're standing and then get you to sit with it, that's the back of the bag. So you can see that sits nicely. Yeah. It may be that we sort of just need to pull up your tummy, whichever side you have the stoma, just to make sure that the back of the bag sits nice and flat. But if you sit back down again, and it still sits there quite comfortably, doesn't it? Obviously the bag will then have to go inside your trousers, but that's usually more comfortable. We just need to make sure that you can see that you wear your waistband here. And is that with most of your trousers?
Yeah, if anything it's higher than that.
And your tights and stuff. And that means the bag sits nicely inside. You don't have the waistband going across the stoma, which might be quite uncomfortable. And obviously you might impact on the waist falling into the bag if you have a waistband across there. All right. Okay. I'm going to get you to do, I'm going to give you a pre-op pack, and it's got a selection of these bags in there. And I want you to go home and maybe wear a bag and put some of your clothing on, all right?
Before surgery.
And just practice with having the bag on. There is also a sachet in the pre-op pack that you can put a bit of water in, so it mimics having waste in there. But actually, for me, it's really about you making sure that where you're wearing your clothes, that is perfectly comfortable. All right. Is there anything particularly you do activity-wise that you might want to consider?
I do yoga.
Okay.
So they're quite comfortable trousers over it, but obviously different positions. And I do running. Okay. Yeah. Perfect. So none of those will be hampered by you having a stoma. You may need to make some adaptations and certainly get back into both of those. Definitely the running a bit more gently. We've talked to you about the core 4 exercises, haven't we, which are Pilates yoga based exercises, so you can build up with those and go back to yoga. It's a good idea to tell your yoga instructor that you've had abdominal surgery and that you now have a stoma, just to be careful. But you will be much more mindful of that. I'll take a photo of that just so that you can see the... Perfect. The emergency setting is obviously it's much more difficult to sight a patient if you haven't got a stoma nurse available. You can follow those principles yourself, but the key thing to remember is that an abdomen obviously looks very different flat than when the patient is sitting up. You can follow the principles yourself, find the iliac crest and the umbilicus, and somewhere between there obviously you can place
where you're going to raise the stoma. Remember that abdomens, if you're too low on the abdomen, it will be underneath often that apron, and then the patient won't be able to see the stoma to care for it, but they also won't be able to place the bag flat. Sometimes this area can look nice, but actually when the patient sits up, and I just want to show you with a stick-on stoma how different that can make for the patient when they eventually come. So if we pop that on there, sitting up, obviously this is a firm stoma, fake stoma, but you can see how difficult that would be so even if a stoma is sited here and it gets pulled in slightly, that is going to be infinitely easier to apply a pouch to a stoma on an outward profiled abdomen, rather than the inward profile is just going to be so much more difficult for the patient to make sure that they get a seal. It requires a level of dexterity and vision to get that stoma bag on accurately. So it's really important that you try and do it on the flattest, most outward profiled area of the abdomen.